Hi everybody, Dr. Drew, a big man talking. Little session today, another little social media catch up, and I wanted to focus down in on answering a few questions I'm getting from consumers who are emailing me, which is fantastic. I love that. And emailing me some questions, and particularly I'm getting questions from their families or their loved ones too about how do I get a provider, where do I get a provider, and how do I know I'm choosing the right provider? So these are important questions because you really want to hold and own your package, and you want to know that the provider is working for you. It's a business relationship you have. You are a customer, they are providing a service, and we want to build a strong relationship, but we want that relationship to be going your way, not their way. So what I've done is I've got a little presentation to give you on asking questions, setting yourself up, and just focusing down a bit on how to prepare yourself to choose a provider, meet that provider, and some of the questions that you will need to ask and should be asking that'll settle you down on stepping into a care package and receiving your home care package the way you want it and the way you deserve it. So sit back, watch this little presentation, click on any links you have, and stay connected with me in the social media, and I'll keep you up to date as the questions keep coming in. So catch you soon. Okay, so here's my little presentation I'm going to give you. It's going to answer a few of the questions, fill your head with a bit of knowledge, and give some of you consumers a bit of power, a bit more power when you start to step into choosing a provider and looking at what you've been given. You've obviously been given your ACAT assessment, you know what package you're on, and now you're looking at what provider you're actually going to use and who do you choose, who's going to be the right one for you. So some preliminaries have already occurred for you, but let's have a look at choosing a provider. Remember the fact that it's your home care package, it belongs to you, you own it, and you should be doing it your way. So let's move over here. The first thing I want you to think about, and people ask me often when I'm sitting with them in community groups or at the club, local club, is who do I choose? Well, I ask you to stop yourself for a minute and start to have a look around. You need to search, you need to ask, you need to build information, build a list of people, and, start to have an idea about what it is that you want. So look at the My Aged Care portal. It's really important. I know it's a confusing portal, people say to me, but be very specific when you go in there what you're looking for. My suggestion is go in and just pull one bit of information out that you want to use. Search your local district, your local newspapers, your council, ask your council, search around where you live. You really want a provider that's local, that's in your district. And you don't just have to look at aged care package people. You can look at brokers, you can look at hairdressers, you can look at anyone that's advertising that they want to give a service to the older person. Ask other people around you if they use a service, what they think. Ask the service when you ring them up if they can give you a link to someone or to some feedback about their service so you can validate and value them. I want you to look at building a list of providers, say 3 to 5 in different areas, and build a list of services that you believe you need help with, and start to grade them 1, 2, 3, 4, or A, B, C, and D. And those you don't want, give a great big fat F to. That's what I'd be doing. And have your questions ready for the providers when you meet them. So have some very set questions around the people you choose, and I would probably play with 2 or 3 providers over a period of interview, and don't make your selection too quick. So let's think about questions to ask. The first question you should ask is, how much do you as a provider charge for administration fees for my package? That is a question that needs to be asked. Providers will charge an administration fee for running your package, which is quite okay. They need to make an income too and pay their staff. But you should be focusing their answer should range anywhere between 10% and 18%, which is about normal for a provider to be consuming or using costs in administrating. Some providers, if you're lucky enough to find them, will be much less, and some providers actually have no administration fees at all and focus wholly and solely on building their costs into the fees of brokered or purposeful service. Another question you should ask is, do they have case management? And do they have case managers? And are their case managers qualified at what they do? You should also ask, if you're not happy meeting their case manager, that can you use your own case manager? Now, the department doesn't really like this, but you still have the choice to do so. I get asked on a regular basis as a gerontological nurse or a specialist nurse, will I manage their case? I have no problems with it, and I make my own arrangement with the provider to cover my costs in case management, and then I get to keep my connection with my patients and clients. You should ask how much case management is going to cost you per hour out of your visits and out of your budget. And you should also very clearly ask, can you broker your own services through the provider? So the provider may have a hairdresser, but they're too expensive for you and you've got a cheaper hairdresser on a good deal. Then you ask that provider to broker a deal with your hairdresser. The provider may have a lawn mowing man, but you might be comfortable with your own lawn mowing man. So you absolutely ask the provider to broker a deal with your lawn mowing man to continue the services that suit you, that you want. You can do this with just about any service available through the CDC or home care packaging. Another question you should ask is, will the provider and the case manager be consulting with the GP? Because you would want that, and you would expect your GP to be absolutely wrapped around what it is you do. You should ask your provider, can you pool your budget? So put money unspent every week or every month and let it pool into a bigger pot of money so that you can use it when you have more sick days, or perhaps you may need to take a break or a holiday or spend a bit of money to travel down south. There may be a little bit time down the line where you may need more money in the package. So you can pool and not use enough and hold it. You should ask, do you have a complaints process? Because you as a consumer have the right to complain, and you should be complaining in particularly if you're not getting the service that you were promised in your contract. And so a complaint service should be open to you. And another question you probably want to sit and ask is around, can I change my care contact days, and what are the rules? So you may have a care contact or cleaner or housekeeper or a carer comes every Monday and Wednesday, but for 2 weeks you have to change the booking to a Tuesday and a Thursday. So you need to have very clear discussion and ask those questions with your provider. How can I change, and can you change care contact days, and what are the rules, and how do I do that? And make sure you understand that, and that you have their contact numbers to do so and stick to the rules. You also have to be compliant to what they need to some point, because they are running a business, and you as a consumer need to understand business is business, and it is like give and take. So there should be rules laid down that to meet, and you should very clearly know what they are. Well, they're the end of my little questions that I've got for you, or my little answers I've got to some of the questions I've got. Please remember, you can visit me at my Facebook page, Facebook at A Big Man Talking, or you can come and get all my blogs, my webinars and my videos at Dr-Drew.com. And keep following me through the internet, keep looking at my social media. I'm going to put up every week a couple more questions, a few more little details about how you as a consumer can empower yourself more, understand home care, your rights, your responsibilities, and build more confidence in working your home care so that you can stay independent, living in your own home for as long as you want to.
And thank you everyone for listening to my little webinar, my little points there of discussion. I hope you got a little bit out of that. If you can take one simple thing away from that, please understand, take control. This is your package. It's been set up and designed in the platform that gives you empowerment, that gives you control. Don't be afraid of providers. They're just people like me. They want to service you. They want to see you get the best outcome you can. So learn the package, learn the rules, and know what you need in your care. Next week, I'm going to have a little discussion around understanding why goals are set in packaging and understanding yourself, and we can have a little look at what's important to you and what's important for you when you start to understand why I need things in a home care package that are going to keep me independent and keep me living in a positive aging space for as long as I can to keep my independence. I'll catch you next week. Happy aging.